ambulance emergency. Tell me exactly what's happened.
With a diabetic coma, we're thinking.
Okay, you with him now?
Yes,
How old is he?
72.
72. Is he awake?
No.
Is he breathing?
No. I can tell you he's not breathing normally. He's getting blue.
Okay, so we're going to check his breathing. Okay, so when I say go, watch him closely. Tell me each time his chest rises. Are you ready?
Yes.
First breath.
1,
Next.
2,
Next one.
3,
And one more.
4,
Okay, good.
5. It's going to be shallow. He's trying. It's really, really awful.
So look at him very closely. Tell me exactly what you see and hear him doing.
Just take some deep breaths, okay? Is he breathing? Is he breathing, yes or no?
Tonight.
Okay, there's a person inside.
Yes. The fire is on the top.
Trapped and burning.
Car is on fire and the person trapped inside the vehicle.
I'm going to stay with you the whole time.
An allergy emergency.
This is life-threatening.
Guys, if you don't need to be here, can we all just step inside for me?
And
How far?
chaos in Chinatown.
How far? Sorry.
Our unprecedented access takes you from the heart of New South Wales Ambulance Control Centre
Keep going. 1, 2, 3, 4.
to paramedics on the front line.
Baby's had a heart attack. What?
Now, is he still breathing?
Okay.
Bailey has taken a call from a remote part of New South Wales where an elderly diabetic man is unconscious and not breathing.
Are you right by him now? Listen carefully. I'll tell you how to do resuscitation, okay? Now make sure he's flat on his back on the floor. Place the heel of your hand on the breastbone in the centre of the chest, right between the nipples. Got it. Put your other hand on top of that hand. Okay, pump the chest hard and fast, at least twice per second and 5 centimetres deep. Okay, we're going to do this 600 times or until help can take over. So count out loud so I can count with you. So 1, 2, 3, 4. 1, 2, 3, 4. 1.
Yep, so look at him very closely. Tell me exactly what you see and hear him doing.
He's trying to breathe.
Yep, so turn him onto his side with his head tilted back. Okay, stay right with him and check his breathing often. I'll stay on the line until help arrives.
Yeah, it's probably terrible. Yeah, but he's breathing.
Yeah, that's the most important thing at the moment, okay? Now, I have been advised an ETA may be around 60 minutes. That is our closest available ambulance at the moment. It will be coming lights and sirens, but we do have lots of help on the way.
Okay.
Okay, so I'll stay right here with you until they're there, okay?
The patient is in a remote area and the nearest ambulance station is 85 kilometres away.
Come on, baby. Come on, baby. Keep going. Keep breathing. Good boy. Baby, don't need it, honey. This woman.
While call taker Bailey stays on the line to the wife of the unconscious diabetic, at Kogarah Superstation, intensive care paramedic Jason and partner Paul load car 885 in readiness for a busy night.
All right.
Good to go?
Good to go. Welcome to the Groundhog Night Shift.
Night shift is about to start on the longest night of the year. Daylight saving officially ends in New South Wales at 3 a.m, pushing the clocks back to 2 a.m.
Extra hour tonight.
Oh my.
The additional hour on top of what is already the busiest night of the week makes it the longest night.
I'm gonna need some snack on the way. I was starving, Marvin.
Did you eat?
I had that mussel mum curry, but you know how small my meals are. Never enough. That's why I'm eating all the time, I reckon. Jason and I complement each other very well. Him being an intensive care paramedic, he provides a lot more clinical knowledge, and I bring in a lot more social knowledge. Together, you know, we're pretty unstoppable. No rest for us tonight. Nah. That's fine, as long as I can get to a microwave.
Yeah, same. Maybe coffee.
Yeah, definitely need another coffee.
Yeah.
Ambulance emergency, what town or suburb? Vincent? Okay, tell me exactly what happened.
Someone in the street just had a car accident and he went into the fence and he's still in the car and the car is just smoking.
Okay, there's a person inside.
Yes. Oh my God, starting lighting. The car is turning. The fire is on the car.
The car's starting to go on fire.
Yeah, he's on fire. Yeah.
Is he trapped in the vehicle?
Yeah, he's trapped.
He's stuck in the car? Okay, I'm organising that help for you now.
I think Sydney to 885. Can I get you started towards the MBA at Bankstown?
A car's gone through a fence. The car is on fire and the person trapped inside the vehicle.
S05, cover that, thanks.
On tonight.
Intensive care paramedic Jason and partner Paul are 8 minutes away. Another paramedic crew is 3 minutes from the scene. And police and fire and rescue are almost there.
When I go to a serious MVA, it is quite a scary thing. There's a lot of dangers. Sometimes the car isn't stable, sometimes it's on fire. I'm thinking, you've got a patient, you know, behind the wheels, trapped. You just want to get this patient out as soon as possible.
One elderly patient there. Car's not on fire. We're just trying to get some bomb responding at the moment.
S05, copy that report.
The first paramedics to arrive report that fire and rescue have extinguished the blaze and are in the process of trying to assess the elderly patient. When Paul and Jason arrive, fire and rescue is already working on the vehicle to get better access to the patient.
You all right, mate? You okay?
Okay.
What's going on?
So we don't really know what caused the accident, but his comments here doesn't really remember the event.
Cool. All right, let's do this.
As the intensive care paramedic on scene, Jason takes charge of the injured man's treatment.
So jump in the car, mate. Get him some oxygen. Yep, copy. Do you have any pain?
The patient's left leg is pinned beneath the dashboard.
So our main concern at the moment is that left leg being crushed. So I'm going to put a teratonicate in it. The right leg is free. Yeah. So we're going to line and we're going to put pain relief. Don't move. Can you get me ketamine, please? Yeah. The longer that somebody's trapped, the more danger they could be in, especially if tissues or muscles are crushed. A lot of toxins are released in your bloodstream. And when you finally release them out, that could ultimately go back into their blood supply and kill them. Okay.
In order to prevent toxins being released into the patient's blood, Jason needs to place a tourniquet around his leg before he can be extracted from the vehicle.
Pardon the tourniquet, the left side.
you want me to get in there and just talk to him?
Yeah,
the noise and shit. So they're just working on cutting your door open so we can get you out, okay? You let me know if you start to feel any new pain. I'm gonna stay with you the whole time. Don't be scared, all right? It's a bit noisy, but everything's all right. Okay, we're gonna get you out. They're gonna lift this up, and we're gonna slide you out this way. But before we do that, we're gonna tighten the strap around your leg. It's gonna get tight, okay?
My hand behind this, over the top of your head.
Hello.
A patient being stuck, it becomes the race against time.
Are we ready yet?
You could be bleeding out, your muscle and tissues could be breaking down. The patient's very sick, but you can't go too fast. Because if you go too fast, it puts the patient and yourself in a dangerous position.
Hello. It is a scary moment. Hello.
We need to get this patient out.
Hey, mate. Are we ready yet?
Once you guys give us the all clear.
Okay. Hello. Hey, mate.
Paramedics Jason and Paul have been called to a serious motor vehicle accident in Sydney's west,
You all right, mate?
where an elderly man is trapped in his vehicle, his leg pinned beneath the dashboard.
Hello. Hello.
Time is the issue for us, so the longer that somebody's trapped, the more danger they could be in.
All good, mate. All good. You okay?
Okay.
It's now a race against time to free his leg and get him the medical attention he needs.
All right, mate. You're doing good? So they're just working on cutting your door open so we can get you out, okay? It's gonna be a bit noisy, a bit bumpy, but then as soon as this happens, we'll be able to get you out, okay?
We're ready to go.
You're good, you're right there, Bobby?
We're all good.
So when we have a patient who's trapped, the moment that you release them, everyone holds their breath.
All hands out.
All hands out. We have significant clearance.
No bruise, no.
We're happy with that.
Yeah, that looks good.
Right, yep, we've got plenty of room. That's plenty there. Just leave that there, Mitch.
You're doing well.
All right, let's tighten. Let's get him out of here.
We've got that board ready. Are you ready? 1, 2, 3.
With the man's leg now free from a collapsed dashboard, the patient remains stable.
You doing okay? Yeah. Good, man. Well, you're out of the car now, so that's good. Yay!
Finally freed and in the ambulance, Jason can properly assess the extent of the man's injuries. Because of the severity of the accident, assisting Jason is Ashlyn, the first paramedic on scene.
Any pain in your shoulders? No. Yeah? No. No pain in your belly? No. Any pain here? A little bit there.
Is that distended and
Yeah. It is quite distended. He's got pain in the umbilical eye area. It does look like there's some discoloration developing.
Yeah. Good to go slowly when you're ready, Paul. Thank you.
Yeah.
When you're in a car accident, there's a lot of forces that are applied on your body. Looking at someone who has, like, abdomen bruising or distension would generally indicate some kind of internal bleeding at that point.
It's definitely bleeding from somewhere.
Internal bleeding is a silent killer. So it is a race against time.
ETA is approximately 5 minutes.
Can you tell me what happened?
Well, we tried to drive it back.
Yeah, dark, yeah.
And we tried to now. We come to cemetery, yeah.
Oh, cemetery, okay, yeah. All right, so you were leaving and then you turned out, too dark, and you drove into a ward, correct?
Yeah.
We're just arriving at Liverpool Hospital. Yeah? A big chaotic scene like that, it's a lot to take in.
but that's what you're trained to do. And at the end of big jobs, Paul and I just look at each other and we know that we've given the best we can into that patient.
Hey, how you doing?
Hello, you must be Rachel.
I am. It's nice to meet you.
I'm Ellie. Nice
Hi.
to meet you.
How you doing?
Our first shift together.
First shift you work with someone, it's kind of like going on a first date.
Saturday night, Liverpool.
Can't wait. You're kind of a very polite, but, you know, by the time you've worked together for 2 months, it's like you have your own little language.
Were you saying it was your birthday?
It is my birthday.
Saturday night in
Can't wait.
Liverpool.
Oh,
Where
yeah.
else would you want to spend your
No
day?
place I'd rather be.
One of the largest ambulance stations in New South Wales, Liverpool Superstation, covers Sydney's entire southwest, an area where less than a third of the residents are born in Australia.
This is a brilliant place to train.
Oh, 100%. I remember first coming out here and I was like, oh my goodness, like such a culture shock. It's just such a big melting pot.
Yeah.
There's nothing like the southwest.
Ambulance emergency, what town or suburb?
Punchbowl.
And tell me exactly what's happened.
We're all having dinner tonight at Grandma's house, and one of the little ones who's anaphylactic has had some butter chicken and had some cashews in it, and he's having a bit actually.
The most severe form of allergic reaction is called anaphylaxis, where constriction of the airway and a swollen tongue can occur. It's estimated that 1 in 100 school-aged children will suffer from it in their lifetime.
How old is the patient?
8.
And does he have any special injections or other medicines to treat this kind of thing?
Yeah, he does have his anaphylactic pen, but Mum doesn't have it on her.
An EpiPen administers a measured dose of adrenaline to open up the airway and is used as an emergency treatment of anaphylaxis.
Does he have any difficulty breathing or swallowing at the minute?
Can you breathe okay? He's just crying. He's very stiff.
Yeah, I completely understand. He's quite distressed.
He's holding on to his chest at the moment, and he's had a huge vomit.
City 884, I'll turn it back around again, please. One's the anaphylaxis and punchbowl.
884, copy that, drop it down. 8-year-old male, anaphylactic reaction, has a nut allergy, does not have an EpiPen.
Am I looking?
You are clear left. Does not have an EpiPen with them.
Paramedics Ellie and Rachel are 5 minutes from the 8-year-old patient.
I have organised an ambulance for him, coming lights and sirens.
The ambulance is coming. They're nearly here, okay?
One of the complications with anaphylaxis is that their airways swell so much that it completely occludes their airway, so they can't breathe.
This is life-threatening.
They can go into a respiratory and cardiac arrest. Ultimately, if it isn't treated as an emergency, the patient can stop breathing and die. Eight-year-old male, anaphylactic reaction, has a nut allergy, does not have an EpiPen with them.
This is life-threatening.
New partners Ellie and Rachel are on their way to an anaphylactic allergic reaction in Sydney's southwest.
Anaphylaxis? It's absolutely life-threatening. Yeah, so you're going to go left and then right. Are you Mum? All right, guys, if you don't need to be here, can we all just step inside for me? Hello, darling. My name's Rachel. What's your name? Yusuf. Yusuf, what's going on today, darling? It's okay. It's okay. You tell me, darling. What's happening?
I ate butter chicken. I didn't think of asking my brother if he had any nuts in it.
Yeah.
He ended up having cashews.
Ah, okay. And he's definitely known to have an allergy to cashews? Okay. Are you having any trouble breathing at the moment? Okay. Can you stick out your tongue for me? Good job. I'm okay.
Did you give him any adrenaline tonight, the EpiPen?
No.
That's okay, sweet.
I had to swap the spoons.
It's all right. Do you feel like it's tight in your throat at the moment? Yeah. What I'm going to do, I'm going to listen to your lungs. Okay, sweetie? You a bit scared? It's okay. You're allowed to be scared. We're going to work together, okay? What I want you to do, I know it's really scary, I just want you to take nice, slow, big breaths for me, okay? We're going to do this together, all right? Nice deep breaths in for me. In and out through your mouth for me. Good. And out. Good. Kids are really receptive. So if they're panicked and scared, It can actually exacerbate their symptoms and actually make them deteriorate faster. What we do is we like to get them nice and calm. We always try and get like a nice, calm environment because we don't want them to breathe faster and potentially make themselves more sick. Yeah, it looks a bit swollen. That's all right. Does it feel like it's hard to breathe at the moment? Yeah. Airway does look quite swollen though in the back, so I think it might be a good idea if we just drop some IM adrenaline.
We don't want it to start swelling anymore.
So what we're going to do, we're going to give you some medicine to help with that breathing, OK? Our priority with an anaphylactic reaction is to administer adrenaline. It's all right, sweetie. So, you know your EpiPen? This is the same medicine as your EpiPen, OK? Just looks a bit different. The adrenaline helps reduce that inflammation in their throat and actually saves their lives. Would you like it in your thigh or in your arm? In your thigh? All right, you ready? It doesn't, unfortunately, fix the allergy. It just stops those life-threatening symptoms. Good job, mate.
Well done, brave boy.
Wow, good job. That's it. It's all
That's
done.
all right,
It's
all done. You're so brave.
That's it. Give it a rub. Yeah, I know. It does sting a little bit, doesn't it? Feeling a bit better yet? Yeah, good. All right, darling, we're going to go up to hospital, OK?
With any severe allergy, the onset can be sudden, but may recur up to 72 hours after initial symptoms, so medical observation is recommended.
It's hard work, hey? It's all right, you're not missing out on much. Snickers, overrated chocolate. Before I started this job, I was a party clown. My name was Bubbles. I absolutely love looking after kids, and especially making sick kids laugh.
Hello, darling. How are you feeling? Feeling a bit better? Rachel's fixed you.
That's right, Mummy, follow us in.
I can't believe you used to be a party clown before you did this.
Yeah, it's my dirty little secret, my past life.
Wow.
I had a bright yellow afro, parachute pants, red nose, the whole thing. The greatest gig of my life. I loved it. If it paid the bills, I'd go back any day.
So have you only just got home?
Yeah, we've had no contact with him since 10:30.
At Sydney's control centre, Bailey is still on the line to a woman from a remote property in rural New South Wales, where an elderly diabetic man is unconscious and struggling to breathe.
I don't know how long he's been in this.
Okay, so he was last seen about 10:30 this morning?
Yeah. Come on, baby.
The response teams were dispatched from 85 kilometres away and are still making their way to the property.
Any instructions for the property here, or it's easy to find?
No, it's not easy to find.
Okay, is there any instructions I can pass on?
Okay, so you've got to go through 5 gates in total, and then there's a pond on the right-hand side. If you hug the pond, you'll come down to another right-hand turn that has like a no through road, private property, don't enter sign. That means you're on the right road. If you haven't hit that, you haven't gone to the right place. We are a bit tricky to get to.
Okay.
They are coming lights and sirens above the speed limit, so they are making their way quite quickly.
It's understandable if he's low in glucose, and I can't get anything into him. I don't want him to choke on it.
Yeah, no.
You cannot? I mean, is there anyone I can try?
I will ask. Bear with me.
In Sydney's control centre, there's always a paramedic on shift to offer clinical advice when required.
Nick here.
Okay, thank you.
Yeah, paramedic on the line. You say the person's been unconscious since about 10:30 this morning, is that right?
Roughly. Yeah, I'm his wife and carer. I'm thinking myself, but I want to phone.
Oh, look, you can't predict these things.
So look, he's breathing, but unconscious.
Yes.
Do we know what his blood sugar level is at the moment?
Blood sugar is 0.8.
0.8. Okay.
The patient's blood glucose is dangerously low. A normal fasting blood glucose range is between 3.9 and 5.6.
Would you be happy giving him some, even like a dollop of honey in his mouth, just something to start getting his sugar level up?
I've got honey, is that okay?
I think honey would be the safest one to start with, but as soon as it looks like he's any risk of his airway, and choking, then we've got to stop it. So just if you can sort of angle a teaspoon of it just into his mouth and try and just to even literally swirl it around in his mouth.
A person with low blood sugar for an extended period of time starves the brain of glucose. Without intervention, the consequences can be severe.
No, nothing's going in.
He's not ingesting it at all?
No.
Look, even if we just get some in his mouth and just let it go through the membranes in his mouth, that's a start. But we can't just put him in there if there's a risk of choking.
Really, darling. Come on, just stay with me. Come on. I've got it in. Wait, I have to go in.
No, well, you've done something. You've got something into him. But it'll help. Don't worry about that. It will help. Been a long phone call. So they're still moving, the ones who are coming. There's 3 vehicles in total. They're not too far off, probably, I don't know, 5 to 10 minutes, I'd say, from the look of it. How about we do another blood sugar level? It may have gone up a little bit.
1.2.
It's okay, so it's coming up.
It's obviously helping because the blood sugar's gone up a wee bit. Try some more honey.
Okay. Come on, baby, breathe. Deep breath, honey. Leave for a little bit. Enough for them to be able to bring it home, okay? Stay with you. Come on, don't you do anything silly and leave. Come on. Stay with you, baby.
How's the pulse rate?
89 at the moment.
What about yours?
All over the shop. Mine's probably 250.
They're not too far out now from the look of it. They just crossed the first creek.
Okay.
They're just about there, I can see it. They're approaching from the south.
Oh, they're coming. Nick, you've been absolutely fantastic.
Well, Bailey's done the bulk of the work.
Bailey, you've been absolutely fantastic.
Thank you for your patience.
You're both sleepy waiting to go home.
They're there?
Yes, thank you so much.
Okay.
And thank you for everything.
No, you've done well. You've done well. It's been an experience.
Thanks, bye.
Good luck.
Wow.
That's a long call. Need a break?
Well, I finished 10 minutes ago.
Oh, did you?
Yeah. Home time.
Log the overtime. Okay, well done.
Oh, no, thank you.
It's all right. No worries at all.
Thanks. Home time. Leave on that note. Yeah.
Ambulance emergency, what town or suburb? Now, what part of the body was injured?
Is he clammy or having cold sweats?
You like hard cheese or soft cheese?
Soft.
Do you?
Yeah. Oh, but I do enjoy hard cheese. I love cheddar. Like a good peppercorn cheddar.
Like hard cheese. I don't know why.
Do you like craft cheese?
Yeah.
Yeah, stuff.
It's just because I think I have more flavour in the harder cheese.
More flavour with harder cheese?
I do like soft cheese, don't get me wrong.
I love soft cheese.
Ambulance emergency, what town or suburb?
We're in Chinatown Marketplace. I'm a market stall holder selling food. So there's a big fire that came out of one of their cookers. Exploded.
From Chinatown in the heart of Sydney, multiple callers are reporting an explosion.
So tell me exactly what's happened.
Okay, hospital itself, the gas bottles were someone influenced by gas bottle, the fire.
Okay. Is he conscious?
Yes, yes. There's a guy with serious burns on the floor, tossing and turning. He's got burns all his face, his arm. He's just visibly distressed.
All right, I'm organising help for you now. Stay on the line and I'll tell you exactly what to do next, okay?
Okay.
Jason and Paul are only 5 kilometres away.
So we're going to a 20-year-old male, serious burns on the floor, tossing and turning, burns to face, arms and legs. Food store cooker exploded.
I reckon burns are one of the most painful injuries.
Yes, they are.
Pain management, airway management, essential.
Obviously, pain is a massive one. but it's also because they've been burnt, a lot of swelling happens.
Yeah.
And they crash very easily because of that.
Every time we get a call of someone who burns, we're thinking, where is the burns? So if you have a very big burns area, there's a lot of fluid that's drawn into that area and you lose circulation. A lot of people drop and die because of that.
The big jobs where you have a lot to take in, you have a lot to do.
I'm going to drive in there a little bit? Yeah. I'll just,
You have to be switched on. That's when the adrenaline comes in and you've got to focus on your training and what you've done.
Very public scene. Wow.
You just got to block it out. Block all that noise out.
How far? Oh, it's not far, like 20 meters.
Okay. And then just focus on the patient, homing in, homing in.
Sorry.
Navigating their way through the crowd, Jason and Paul, together with the second crew, locate the patient and immediately begin to assess the extent of his burns. It appears his right arm has sustained the most severe burns.
What's your name, mate? Louis. Louis, you remember what happened?
I just opened the gas and all fire.
Yeah, where did it get you? Did it get your face?
Yeah, a little bit here.
Yeah? Can I have a look at your chest?
Once you're, exposed to a burn injury, your skin keeps burning. We give active cooling, which is cool running water. We have to do it for 20 minutes post burn exposure because that's how long your skin can burn.
We're going to get you in our bed and get you into the ambulance. Too many people here.
Having a lot of people there makes it very difficult to keep the patient safe, and it's harder for communication.
Are you guys taking him off? Yeah, we're going to go take him into the car just with some discretion for him.
Putting patients into the back of the ambulance where it's, quieter and all your equipment's around you if anything goes wrong. If he crashes, we've got a cannula in, we can deliver drugs.
You're all right. You're in pain, mate? Scared? You're all right. Look, I'll tell you something right now. You're all good right now, okay? All your numbers are good, okay? This doesn't seem too bad, okay? All right, we're just going to quickly assess you and go from there, okay? Are you in a lot of pain right now?
My arm.
Yeah.
My face is burned as well.
Yeah? All right.
At those points where, the patients are very emotional, it's all about making, them feel safe at that moment.
Sorry, yeah, his lashes are singed.
My eyes.
Your eyelashes.
Eyelashes, yeah. It's the rave these days, so.
They'll grow back.
Do you feel short of breath?
No.
Yeah. Can you open your mouth for me? Flick out your tongue. Cool. You got a shirt tan normally?
What?
You have a shirt tan?
Yeah.
Yeah, that's normal?
Yeah, that's normal.
Okay, cool. Some facial burns, but there's no airway involvement right now.
There's nothing like that.
Huh?
There's nothing like that in my face, right?
No. So we're looking at 1% full thickness and then 2% more superficial.
Full thickness burns or third-degree burns occur when all the layers of skin are destroyed and the tissue and muscles beneath are severely damaged. Burns of this type are extremely painful and require specialist treatment.
What will happen to me now?
So you're going to go to hospital, you're going to see by a doctor there, they're going to quickly assess this, okay? Just this part, that's the worst one that we'll have to deal with. The rest, just monitoring and it should recover. Yeah. Okay. I'm gonna give you some pain relief. It's quite strong, okay? It's quite a safe drug as well.
It's harder to pull water on.
Yeah, I think we've got 20 minutes now. That's good.
How you doing, Louis? You better? Hola.
Can I call my mom?
Yeah. Just say that you've just been a bit burnt and you're just going to hospital for, a few more treatment, but you're safe.
She will see me like this and she will get
freak out. Yeah. Oh, definitely not FaceTime, huh? Yeah.
Yeah.
It's the longest night of the year for New South Wales ambulance responders. Daylight saving winds back at 3 a.m, making 2 a.m. last for 2 hours.
Oh, that sucks. 4 hours to go.
Yeah, my break's at 3 too.
Yeah, another hour. Take 2 breaks. Go at
No,
9 minutes.
no.
No, not 3.
No.
No, our break was at 2:10. Ellie's not having it. She's like, nuh-uh. Our break is at 2:10, so we're on it now.
No.
We're delayed.
No.
I'll never understand
no.
daylight savings. And then 2:10 again.
Happy daylight savings. It's now 2 a.m. And it was 2 a.m. an hour ago. And now it's 2 a.m. again.
I'm one of the weird ones. I get excited for night shifts because I find that the work is just a little bit peculiar.
Still control 885. I've got a 1 seat welfare, as you know.
I have, I've copied that, drop it in. Let's around the corner. We're going to a call from the police for an 80-year-old female concerned for welfare.
The patient's niece, concerned for her aunt after a personal alarm was triggered, alerted emergency services.
They just haven't had contact with her, so it's a life status.
20 seconds. Yeah.
It's all locked.
085 Sydney.
We can't get into the house. We had to call rescue at this point.
Occasionally we do have to do welfare checks because people have loved ones who live far away and they need somebody to go and check on them, but there is nobody else. And we're always happy to go and check on them.
Sometimes it's always good to ask the neighbours. Knock, knock.
Yes.
Hi, how are you?
Good, thank you.
Do you know the person that lives in this house over here?
I know, but I think you know from my neighbor there. I think they get the key and over there.
Hello.
Jane. Yeah. This lady, you get the key for her.
Oh, the ambulance. Up at number 5.
Number 5?
Number 5, yeah.
I'll go up.
Despite enlisting the neighbours, Paul and Jason are unable to access the patient, so police arrive to assist.
We've spoken to neighbours and they've got a spare key somewhere. Yes.
Try and go that avenue first.
With a welfare check, we're not going to go anywhere until we know that the patient is okay.
I've got the keys to the house.
Oh, yes, she is.
Finally, a neighbour with a key is able to help Paul and Jason find the patient.
Oh! Hi.
What's
Marie.
wrong?
Apparently one of your nieces called us. Are you okay?
I'm fine, thank you.
You're not hurt or injured or in trouble?
No.
Oh,
No, I
okay.
haven't had a fall or anything like that. I'm okay.
Yeah, there's no need for us to be
I'm sorry
here.
you had to come out.
No worries. This is the best outcome for us. We don't want to disturb you anymore if you're safe.
Yes, I'm
Yep.
safe and I'm well.
Okay, excellent.
Yes.
Alrighty.
I'm so sorry you had to be called
All
out.
good. Do you want to head back and I'll close up the door?
Thank you very much.
All good. Bye. Take care.
Thank you.
You're welcome.
Not every job we go to is lights and sirens and serious injuries. Sometimes it's as simple as providing just some support and help for people in our community. And I wouldn't have it any other way.
Back at Sydney's control centre, the longest night is drawing to an end, but the calls continue to come in.
Ambulance emergency, what town or suburb?
Is there any serious bleeding?
Does everyone appear to be completely awake?
Just tell me exactly what happened. So I've got a 23-month-old. She's been unwell all day. Only in the last hour she got worse. She's been coughing so much she's been vomiting. Okay. Does she have asthma or other lung problems? She's definitely got respiratory issues. Has had pneumonia. Yeah. Which led her to a heart attack, which led her to trachea. Understood.
So I've organised that help for you now. Just stay on the line and I'll tell you exactly what to do next.
We are going to a 23-month-old baby that's got a tracheotomy, so it's got a tube in its throat. There must be some underlying condition. It said the baby's had a heart attack in the past.
23-month-old has had a heart attack. What?
I think going to jobs where there's kids involved, it's always really hard because you think of your own child. You want to wrap your children up in cotton wool and protect them from some of the awful situations that you see other children in.
It's got secretions coming out of its tracheostomy site.
The baby's got all these different medical problems. Should have a specialist so they'll know what hospital they want to go to. You know, I love going to kid jobs, but then there's also the side of paediatric jobs where you are going to a paediatric cardiac arrest, and I think that's hard to get over.
Tracheostomy, secretions increasing.
Paramedics Ellie and Rachel have been called to a 23-month-old toddler with a history of pneumonia and a heart attack who lives with a breathing tube.
Not clear at all, is it?
3. Hello. Who's this beautiful girl? Portia. Hello, Portia. You got lots of hair. So what's been happening?
Portia's been sick since last night.
Okay, in what way?
Just cold and fluey.
Okay. Have you checked her temperature?
Yeah, it was just 37.5 then. She just had Nurofen. She had Panadol before, but she was like, her little tootsies are really cold.
Yeah. Okay. I'm just going to have a look at her chest. Hey, sweetie. Her trachea's been, she's got a lot more secretions than normal, is that right?
Ridiculous amount of secretions.
Okay. Have you got your suction out ready?
Because of Portia's tracheostomy, the only way to expel her phlegm and secretions is through manual suctioning.
Well done, Mum. You're doing a really good job. Which hospital does she normally go to?
It's in Children's Renwick.
Right, okay. So just tell me, so what's her underlying medical condition? Why has she got the trachea?
So basically, Portia had sepsis pneumococcal last year in May.
Right.
She used to have a cardiac arrest at Sydney Kids.
Oh, did she? Okay, when was that?
May 30th last year.
Bless her, she's really been through it. You guys are doing a really good job. Is she still in nappies?
Yeah, she's got cerebral palsy as well.
Right.
Cerebral palsy affects the ability to control muscles, and it can lead to respiratory issues and delays in a child's development.
As a mother and being a single mother, I can just imagine what they're going through. She's got a temperature of 39. With a temperature like that, and with her medical history and the fact that the secretions are green, she's probably going to need some antibiotics.
Because of Portia's elevated temperature and increased amount of secretions, an infection is likely, so a hospital visit will be necessary.
All right, we're just going to start heading out. Would you prefer to sit on here and hold her? Is she going to be all right? She's pretty upset.
Yeah, I might have to.
Yeah. All right, beautiful. It's all right, my darling. I think the main thing is just keeping her calm. Okay?
Come here, Sissy.
Come on, beautiful.
Come here. Hey, hey, hey. It's okay. It's okay. It's okay. I know. Are we going to go on an adventure?
She's laughing. Yeah! Good. She must be feeling a bit better. That Panadol's starting to kick in. Yeah. And hopefully all it is just a bit of an infection. Fingers crossed. She won't be in for too long. But you guys have been through so much. She's such a little fighter. Yeah. I've got two children myself, and she's such a tough little thing, isn't she?
Oh, she
like, oh, so she's 2 next
couple of weeks. They've planned to buddy. There'll be balloons and bubbles.
Oh, that sounds great. I know a party clown.
You're not supposed to tell anyone my dirty little secret.
Hey, Portia, where's your baby? Say hello.
Can you wave?
Can you wave hello?
Hi.
Good girl.
Good girl.
Good practice. What about high fives? Where's your high five?
You high five? Oh, you give me a high five?
Good trying.
Oh, good girl. That's a great high five.
Better.
What I've learned in this job is how fragile life can be, and and it makes me want to fill my life with as many memories as possible. Try and live every moment like it's your last. Oh yeah, perfect. Well done.
Last bumps means you're there.
Good girl. You've been such a good girl. That mum to have a baby that needs so much medical intervention and constant medical treatment with a suction. I just think what an amazing woman, and what a beautiful child. It makes me truly blessed to have healthy children. We had to take the baby to the correct hospital, so she received treatment with a previous cardiac arrest and septicemia. We just don't want to have any further complications for that mother and child. That mum is doing such an amazing job.
She's phenomenal. My goodness.
That baby has been through so much. She's about to turn 2. And you're going to visit in your...
I'll have to bring that out of the closet, my old party costume.
You shouldn't have told me.
Next time...
Sydney Control, helicopter 2206. We are now airborne.
A knife attack emergency.
May was slashed in the throat with knife.
This might be one of the biggest jobs I've ever been to.
Car hit pedestrian.
Thrown from an electric scooter.
I'm thinking the worst.
Yeah, I can't feel it.
You can't feel your leg.
And...
He's inside, is he?
Dizziness at work.
I can't stand up.
Leads to something much more critical.
It definitely looks elevated, doesn't it?
Yeah. There's something not right here.
Yeah, a bit worrying now.